Hello everyone, today we are going to talk about stomach cancer. We all know that cancer is an abnormal growth of body cells in out of your body control. One of the organs affected by this cancer is the stomach. Stomach cancer begins as cancer cells from the inner lining of your stomach. These cells grow into a tumor, also called gastric cancer. This disease usually grows slowly over many years. Although this cancer is common worldwide, it is widely spread in East Asian countries. After watching this video, you'll be able to know all about this cancer, such as its symptoms, types, how to diagnose it, and the available treatments of the serious disease. Our role today is to answer most of your questions regarding stomach cancer. Today we have Doctor Seo, who is a leading doctor at Seoul St Hospital. He is going to discuss with us everything about stomach cancer from an experienced medical point of view. I'm Ume. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Seo. Very nice to meet you.
Yes, hello.
So before we start our questions today, can you present yourself?
Hello, I'm Seo Seok, who works in the stomach surgery department of Catholic University of Korea, Seoul St. Mary's Hospital.
Good. So today we'll be talking about gastric cancer. Let's start by a definition of stomach cancer.
Stomach cancer is often one of the common cancers in Korea. The upper part consists of several layers, which can be largely divided into 4 layers. And the innermost part through which food passes is called the mucous membrane layer. The mucous membrane consists of a variety of cells, which become cancer cells due to some variation. And the disease in which the cancer cells are growing is called stomach cancer.
Okay. So usually what causes stomach cancer?
It is known that stomach cancer has several causes. There are genetic and environmental causes, and a well-known cause is Helicobacter pylori. This bacterium is known as a definite risk factor, as it has been identified as a carcinogen in the WHO. In general, what patients are most curious about is which foods affects the occurrence of stomach cancer. Usually eating a lot of salty food shrinks the mucous membrane, and is prone to mutations in the process. This phenomenon can also be a cause, but there are many types of stomach cancer, so the cause may vary from type to type. Helicobacter bacteria, salty food, and stimulating food are considered risk factors.
Are there many types of stomach cancer?
There are so many types of stomach cancer in detail. If divided into large parts, there are well-differentiated stomach cancers and less differentiated stomach cancers. There's not much difference in treatment, but there is a difference in the degree or prognosis of response to the treatment. However, there is no need for the general public to know.
How about the symptoms of stomach cancer?
Stomach cancer has a different degree of progression from country to country. In Korea, gastroscopy is performed a lot when receiving medical checkups. Globally, Korea and Japan have the highest incidence of stomach cancer compared to the population. There are many stomach cancer patients in Korea and Japan. Therefore, in these 2 countries, many tests are conducted to detect stomach cancer early. Endoscopy is also frequently performed, so about 70% of patients in Korea detect stomach cancer early. Most of the early stomach cancer has no symptoms. Some patients complain of indigestion or heartburn, but this symptom is often not related to stomach cancer. However, stomach cancer has progressed, and if diagnosed as stomach cancer, symptoms such as heartburn, indigestion, black stool, weight loss, and vomiting can be shown. If the examination is performed when the symptoms are present and stomach cancer is detected later, the treatment timing may be missed. Therefore, in order to detect stomach cancer quickly, you need to have a medical checkup regardless of symptoms.
So how can we diagnose stomach cancer?
The most useful method for diagnosing stomach cancer is endoscopy. Endoscopy is common in Korea because the price of endoscopy is low and people do a lot of medical checkups. However, endoscopy is also the most accurate. In countries where it is difficult to receive endoscopy easily, a method called upper gastrointestinal angiography is performed, in which patients take potions and take x-rays, or when bleeding in the gastric mucosa, stool test is performed. However, it is relatively less accurate than endoscopy. Currently, the best method is endoscopy.
상대적으로 정확도나 이런 면에서 좀 떨어지기 때문에 가장 좋은 방법은 내시경이라고 말씀드리고 싶어요.
Okay. We talked before about the types of cancer. I would like to ask you about the stages of cancer.
Stomach cancer is largely divided into early stomach cancer and advanced stomach cancer. Early stomach cancer refers to cancer that initially finds stomach cancer and treats it well. And advanced stomach cancer refers to cancer that is more advanced. Progressive stomach cancer does not mean that treatment is not possible, but it refers to cases where additional chemotherapy is required depending on the timing of the discovery. When doctors classify this cancer, it is divided into stage 1 to stage 4, and in detail, it is divided into 1A, 1B, and 2A, but largely into 4 stages.
All right. So if it's confirmed it's a stomach cancer, how is it treated afterwards?
The treatment method depends on the condition of the disease, the transference, the location of the cancer, and the metastasis condition. Fundamentally, surgery is the most important thing in stomach cancer treatment. It is an important treatment to cut off the cancerous stomach and resect the lymph nodes around it extensively. Additionally, biopsy with the cut tissue shows how far the disease has progressed. And depending on the stage, necessary chemotherapy may be added. This is the standard treatment method. Among early stomach cancers, endoscopic resection, not laparoscopic surgery, can be performed if several conditions are satisfied. This procedure is to cut out only the mucous membrane and the lower layer of the mucous membrane using only the endoscope. Depending on the patient's condition, this procedure may be possible. Stage 4 stomach cancer refers to a case where cancer has metastasized to another organ. In this case, cancer cannot be completely cut off by surgery, so it is basic to proceed with chemotherapy first. In the past, I used to see the improvement of the disease by only chemotherapy. Since then, if the chemotherapy response is good, the metastatic disease disappears, or the area where the disease occurred can be cut off. Conversion surgery to perform surgery again after chemotherapy has been actively conducted recently.
Okay, let's talk now about the prognosis. So what kind of what's the percentage of mortality, of reoccurrence?
Depending on when the stomach cancer is detected, prognosis varies very sharply. For example, if it is detected early, undergoes surgery, and there is no problem, 1A of stage 1 shows a 5-year survival rate of 95% or more. And the survival rate specific to stomach cancer is 98 to 99%. However, in the case of stage 4, if the cancer spreads elsewhere in the organ, and surgery is not possible, the 5-year survival rate is considered to be less than 20%. Early diagnosis is the most important thing in stomach cancer because the survival rate is very different from 20 to 90%.
Okay. So does inheritance play any role in having stomach cancer?
It's difficult to say that stomach cancer is hereditary compared to other diseases. Most families have similar eating habits, and even if they do not have the same eating habits, the incident rate is high if their parents or immediate family have stomach cancer patients. It can be said that it has a genetic tendency, but it's hard to say it's genetic disease.
So how about age and gender? Does it affect the likelihood of having stomach cancer?
I mentioned earlier that stomach cancer can be largely divided into 2 types. The 2 properties are slightly different. The well-differentiated type represents the common referred to stomach cancer properties. It occurs twice as often in men, and in Korea, it occurs the most in their 60s and 70s. However, recently, undifferentiated stomach cancer is increasing, which tends to occur relatively often in young age groups and women. Looking at the trend of stomach cancer in Korea, as the age of stomach cancer is gradually decreasing, the age of well-differentiated stomach cancer types is increasing. It can be seen as a polarization phenomenon. The increase in the age of onset is also due to the increase in life expectancy. Although the proportion of men is still twice as high as that of women, the proportion of female patients is also increasing.
All right. So one last question about the stomach cancer. How can we prevent it? Is it possible to prevent it by making some changes in lifestyle, for example?
There's no clear study on this. It's difficult to say that stomach cancer can be prevented by changing eating habits. Of course, it is expected that reducing salty food will have a stomach cancer prevention effect, but it is difficult to provide accurate figures for the effect. Helicobacter pylori is known as a clear stomach cancer incidence factor, so if the bacteria are found through the endoscopy or other tests, removing them is a way to prevent stomach cancer. Since stomach cancer treatment has very different results depending on when it is discovered, rapid treatment through rapid detection is very important. In order to treat stomach cancer well, it is very important to have regular medical checkups and detect them quickly.
So fast diagnosis is key. All right. Today we learned many things about stomach cancer, and the doctor explained in details everything related to this serious cancer. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.